There are an estimated 75 to 80 million dogs on India's streets. Every 2 seconds, someone in this country is bitten by one. Children are attacked outside school gates, patients are mauled inside hospital campuses. And yet, for over 2 decades, the law that was meant to fix this, the animal birth control rules, has existed largely on paper, ignored by municipalities, starved of funds, and unsupported by the very government that mandated it. Earlier this month, the Supreme Court of India passed a sweeping judgment directing that stray dogs be removed from schools, hospitals, railway stations, sports complexes, and, remarkably, religious and tourism sites. In its judgment, the Supreme Court said they should be relocated to shelters that frankly do not exist. The court meant well. The problem is very real. But today, we are going to ask, does this judgment actually protect dogs or people? Or does it set us back by years and lead us towards a less humane future? Listen on, it's Friday, the 29th of May. I'm Anirban Chowdhury. This is the Morning Brief. Let me start where all this began. In November 2025, the Supreme Court issued an order, suo motu, directing that stray dogs be removed from a list of sensitive locations. And not just removed, not to be released back. To be held in shelters. Sterilized first, yes. Vaccinated, yes. But gone from where they were. Then, in May 2026, the court passed its full judgment, clarifying, expanding, and in some ways doubling down on those directions. It acknowledged that the animal birth control rules exist. It even said implementation has been, and I'm quoting the judgment here, ineffective to say the least. But instead of asking why and fixing that, it layered new, arguably undeliverable obligations on the same broken system. My first guest today is Gauri Maulekhi, an animal rights activist, legal and policy expert, and trustee at People for Animals India. I asked her, how does she see the judgment?
It does not serve the strays, but it does not also serve the human population that it sort of aimed to protect. I suspect that the trajectory that the court has proposed will only aggravate man-animal conflict and will lead to a lot of undoing of the good work that had happened.
Why do you think so?
So there was an animal birth control program mandated by the government since 2001, and it was based on scientific lines, on WHO's recommendations. While not much was done about it in most, municipalities, some of them did do a lot of good work, and tangible, measurable improvement in conditions was noticed, not just noticed, but empirically recorded. And now with this new regime that is going to come about of capturing, removing dogs, relocating them, we're basically going to confuse the entire country and, the human and animal population, and it's going to lead to an anarchical situation. That's what is very evident.
Gauri, what do you think is critically wrong in the order?
There are many ambiguities in the order that has left, the lawmakers, the bureaucrats, the animal welfare organization, and other civil society people very confused. For instance, I'll give you an example. The order proposes that dogs to be removed from certain areas. Look at the absurdity of saying that remove dogs from religious and tourism places. Well, those might cover entire cities. What do you do with tens of thousands of dogs? I mean, where do you take all the dogs of Banaras? Where do you take all the dogs of Agra? In fact, there's an interesting statistic that I would like to share with you. We placed before the court that if all the dogs of only the schools and colleges were to be picked up, and kept by the state governments for life, the annual budget that would be required only to feed these dogs, forget the capex cost in creating these shelters and the manpower cost in looking after these animals, just to feed, only if these animals are to be fed every day, the annual cost would exceed the entire budget of 33 ministries of the Union of India. So, where does the court want our priorities to go?
What should have been the judgment?
We already had the judgment that we wanted, and probably reinforcing it and holding the executive accountable for time-bound action would have been a good one. So in 2016-17, when this matter was being heard and detailed orders were passed, so dog matter was being heard since 2009. And Justice Maheshwari's bench later wrapped up the matter in 2023 by saying that the rules need to be applicable. The rules have to be applied by all municipal corporations and state governments. And whoever doesn't follow the rules, the high courts may intervene and pull them up. And the high courts are doing exactly that. But during the course of these proceedings, the Supreme Court called all the matters that were going on in the High Courts to the Supreme Court, to its own bench. And then now, a few months later, sent them right back again. So even the High Courts are confused. When they were hearing the matters, for instance, Jammu Kashmir High Court, Kerala, Maharashtra, Uttarakhand, Delhi even, all these High Courts were listening to various matters regarding stray dogs in their own unique geographical conditions, their own unique challenges with the municipal corporations and the bureaucracy and the political class. But they were all suddenly brought to a naught by transferring them to Supreme Court in November. And then come May, they're sent right back saying, institute new cases now in every single High Court. So proceedings basically come right back to zero. All the proceedings that had happened, all the affidavits that had been, deposited, all rejoinders, counters, replies, all of that has come to naught. And now we start from scratch once again. So it's been a massive wastage of judicial hours. And like I said, it just confuses all of us.
Exactly. Final question, Gauri. What is the worst that can happen as a result of this judgment? Cullings, do you see that increasing quite a lot, or where do you see the next few months or a year?
Clearly, the corporations and state governments cannot run shelters for lifetime for dogs. So undocumented, surreptitious culling of dogs is an absolutely real threat. The bigger threat is rift among people, women getting beaten up on the roads, because most of the times it's ladies who go around feeding dogs or taking care of them, and that is a real threat. It's already been happening. Now the court has said that even FIRs cannot be lodged. Now the fine line that if certain officials are doing bona fide work will probably be ignored, and FIRs cannot be lodged has become headline already. So that is going to be difficult. And from the court's perspective, I think the worst thing that will happen is that rabies incidents will spike throughout the country.
Now, India's stray dog policy debate is often framed as a fight between animal lovers and public safety. But the real problem is something more basic: implementation failure. Now, the animal birth control rules that I spoke about in the beginning of the episode, which is basically sterilizing and vaccinating street dogs to gradually reduce their numbers, are supposedly the biggest deterrent to the problem of proliferation of strays. The rules have existed since 2001. The Supreme Court has been deliberating on street dog management since 2004. The first matter of this, in fact, was in court for 11 years. The court has reiterated time and again that birth control rules should be implemented to the T. But neither the centre nor states have made adequate efforts or investment to that effect. In fact, only a handful of places in India have run proper long-term ABC programs. As a result, authorities frequently resort to what is called culling, the mass killing or removal of dogs after a bite incident or public outrage. So, it's usually non-profits, about a few thousands in the country, that take it upon themselves to push humane, scientific solutions to the problems of strays. One such organization is the Humane World for Animals, and my next guest is Alokparna Sengupta, its India Managing Director. I began by asking her the crux of the problem. She said,
It's a lack of intent, it's a lack of will, it's just inertia in the system. So, for example, in the 2001 animal birth control rules, there's another rule called the establishment of district SPCAs. Honorable Supreme Court said every district must have an SPCA, which is headed by the collector and has the veterinary husbandry department, veterinary department, and has its own infirmary and care. This needs to function as a infirmary for hurt or case property animals. That has not been done. Tenders are hardly brought out. In Andhra Pradesh, the what was found out that all districts had SPCAs and ABCs were being done just on paper. So papers are filled, tenders are filled out, but nobody's really doing it. We came to know in Hyderabad, where I am from, again, it was said that ABC was being done, but animal activists and advocates found that dogs, the testes were being removed, ovaries were being removed, but the dogs were being culled. So when you are doing it like this, you're not able to actually even see whether it's a success or program because it's a failure to start with. There is a lot of corruption. There is a lot of red tapeism. I mean, there is just so much the lack of speed, right? In payments also, we can afford to get donations from somewhere else and pay our staff. But a lot of smaller organizations, they have taken up tenders for animal birth control. They're not being paid months on end, so they have to just shut shop and go. So, and then there are no other NGOs to take on animal birth control.
do you also see the animal birth control rules broken or inadequate?
There is criticism of the animal birth control rule or the sterilization and vaccination itself, saying that, hey, is this the most scientific? But we all often think of it as the silver bullet for human animal conflict, right? Like, oh, if we do sterilization, animal population will reduce and conflict will reduce. But that's not necessarily true. So we really have to put more research into street dog welfare and human dog coexistence. But animal birth control rule, since it started in 2023, once it was amended, I think it did bring in a lot of community engagement, a lot of accountability on the community. It's set up your state animal monitoring, ABC monitoring committees. So there is infrastructure built into the law. But again, implementation is the problem. The science of it needs to be updated time and again, but I don't think we can rely on the government to update the science. We need to work with researchers and experts on that.
Now, Alokparna, coming to the judgment and the challenges around its implementation on ground, one of the points that the Supreme Court mentioned was that stray dogs picked up from sensitive public spaces, like schools, hospitals, bus stands, railway stations, basically high footfall areas, should not be simply released back there. Now, the question obviously is, where do they go? And then the follow-up question is about dog shelters. Do we have adequate numbers of those shelters? Has there been an effective push and investment for constructing more of them? Are there enough people manning them? What's the scenario there?
Yeah, I mean, I think that's the sore point of the case, of the entire judgment, right? Because firstly, to say that where there is high footfall of human beings in the most populous country of the world, where in India will you not have high footfall of people is the question. Initially, when on this 3rd November or the 7th November judgment hearing, in the order they said that, oh, build walls, build wires. Okay, campuses you can. Bus stations, railway stations, is it really possible? The amount of infrastructure that is required and budgeting that is required is insane. And I think there was a lawyer, Advocate Shukla, who came and said that, you're not building homes for abandoned and homeless girls in the country. And I can't take it that you're saying that build shelters for dogs, because at least because the dog is there. And as I say this and I recall her urgent plea, I have goosebumps now also. She said that at least when a dog is there, I know that the 13-year-old girl who is homeless and sleeping on the railway station is protected from assault, from any sort of sexual advances by people there. And that was so powerful, according to me. But having said that, In the petitions from various organizations, including ours, we had said that, you need just for one state or maybe a few districts, at least, okay, for Telangana, we had done some 100 crores just for shelters. And that was a one time cost. Then repeated costs for manning it, for ensuring that the dogs are actually healthy there is a different budget altogether. The government does not have so much. And Supreme Court judgment actually negated that and said that, oh, budget that was given in the petitions has been overstated. But it's not, because where is the land, where is the infrastructure?
Correct.
So it is not possible. And we have seen in other countries where, shelters, and including in ours, before 2001, dogs were being killed and culled and treated horribly in shelters. And it did not work then, it will not work now. In other countries, they were also sheltered and it did not work out. So, one, there is no infrastructure. Two, if you put them there, you know that it is a certain death, slow death. If they are culled immediately, that's a relief. But if they are not, then it's going to be a horrible, slow death for these dogs. And that's not the society we want.
Okay, now let's get to the society we do want, and the one you are and your organization is helping create. Now, Humane World for Animals has helped sterilize lakhs of dogs in Uttarakhand, in Gujarat, in Karnataka, and in Uttar Pradesh. Tell me about it. Let's start with the example of Lucknow.
So Lucknow we've been in since 2019, and it was one of the biggest cities we took up because the population was high. It was a large city and a growing city. Since 2019, we've been able to sterilize over 1 lakh animals, 1.5 lakh, I think now, and it has come to about 25 to 80%. And this includes community engagement. We had a program in Vadodara which ended in 2020. By then, we had finished 86% of the dogs, street dogs, sterilization, and we had handed the program back to the municipal corporation. Now, local organizations continue to carry on sterilization and vaccination while we are there for community engagement. For Uttarakhand, we've taken it as we want to create a model state for dog sterilization, vaccination, and human dog conflict. So we've done various parts of Uttarakhand. So in Dehradun, we've completed about 85%. We actually handed back Nainital back in 2023 with 99% street dogs sterilized and vaccinated. We intend to go back to all these cities and redo annual vaccinations because their tighter levels of vaccines should not reduce, so that they are protecting them. We are protecting them against rabies and we are protecting the people against rabies. The results are good, and in Dehradun especially, we've seen a 40% reduction in dog density.
Why is that happened? Because of the sterilization, or?
That's because of the sterilization and non-relocation. So the animals have continued to live in those places for their lives and died there, and no new animal has come in.
Okay.
So, and that is what is important. That is what is going to reduce dog density in the long run.
Alokparna, so is there generally more empathy towards stray dogs in India now, especially in smaller towns, and also the desire to be more aware about how to treat them better?
In my experience and in the experience of the organization, small towns, rural areas are more tolerant to any sort of conflict. They are more empathetic. Even, for example, we work in a small town called Dharwar, Hubli Dharwar in Karnataka. And we've seen, like, if there's a street dog or a community dog who has been injured or sick, they actually take their day off and call us. We have a mobile animal clinic there. They call us, they spend the day, they ensure that if a drip is required, they will purchase it themselves and follow the instructions of the vet. In Dehradun also, we've seen that if Dehradun ho ya Lucknow bhi ho, we have seen that when there is conflict, the community there wants to find a solution. They don't want to come and say, "Yeah, just take the dogs away." That is mostly seen from a little more urban, little more privileged society, that's where there is a lot of intolerance. Anirban, I do want to also say that in Dehradun, we've worked for 10 years with, working with communities, creating awareness, attending complaints. A lot of the complaints come in because people think that there is nobody to hear their problems. The minute they understand that, hey, we are here to hear you out, and we know what we are doing, and these are the solutions, we'll come to a middle path, it does provide a solution.
Finally, what are some of the lessons that we can take from international examples?
Yeah. I think closest to home is Bhutan, because last year Bhutan came into the news because they became 100% sterilized and vaccinated country. So there was initially a lot of culling, shooting, and hoarding animals in shelters, which then led to massive disease outbreaks. And of course, budget could not be maintained. And that's when in 2009, this was Humane World for Animals, used to be Humane Society International at that point. Our global organization, which included some of our Indian staff, went there, spoke to the royal government, and started with a pilot in Thimphu. And it became one of the longest collaborative project with the government that our global organization did till 2016. After that, they handed it back to the government till 2024 with volunteers, 15,000 volunteers. The government fully supported the sterilization and vaccination, and now there are rabies free and 100% sterilized and vaccinated. In Mauritius, we used to work on this issue many years back. Mauritius became infamous because the shelters they were using, like it would be in India, right? If there were shelters where dogs were eating each other, there was such lack of welfare, lack of food, lack of water. So there was again our organization did a pilot in one location. Then the communities supported spay, neuter, and vaccination. The government actually tried to stop it, but there was so much public pressure and animal welfare organization pushback that still now, spay and neuter continues, and we don't. And Mauritius does not have rabies at all. Again, closer to home, Bangladesh. Bangladesh used to do culling till very recently, till about 10-15 years back, and then the Bangladesh court passed an order to stop culling, and now Dhaka and one of our partner organizations there called Abhay Ranno, they actually have a pilot in South Dhaka, which they've expanded across Dhaka. So there are these places which are doing good work, have had the same issues we have had, and now they're doing consistent work, which has led them to have no rabies at all, 100% sterilization and vaccination, and better human-animal coexistence.
And this is like a great place to zoom out, because the argument India is having, sterilize versus relocate versus cull, is not unique to India or its neighbors. It has happened in the West, in countries like Philippines, and in sub-Saharan Africa. And in many of those places, it has been resolved, not by courts, not by culling, but by science, community, and consistency. Luke Gamble is the founder of Mission Rabies, which currently works on sterilizing and vaccinating dogs and eliminating rabies across 26 countries. I started by asking him to give me the example of one country that has dealt with its stray dog population in the most humane, efficient, scientific way.
So there are some great examples. When we first went to Malawi, for example, in southern Africa, Malawi, there's a hospital there called the Queen Elizabeth Hospital in Blantyre, and it annually recorded the highest incidence of child rabies deaths from any single institution in the whole of Africa. And annually, they did a roundup where they used to kill all the dogs, shoot the dogs, any loose dogs on the streets.
Oh, God.
And it was horrendous, and I actually remember going to the hospital and the roundup had just happened, and they'd even shot out a window in the hospital. It was absolutely crazy, because obviously dogs congregate a lot around places like that because there's lots of food and all that sort of thing. So, and Malawi is a wonderful country with wonderful people. And we went there and we worked with the local charity, we worked with the local government, and we set up a program to do neutering, to do vaccination. And in 6 years, there was a paper published in The Lancet, and it showcased how the approach that we'd adopted with the government had transformed the annual statistics of children dying from rabies in that city and in the country. So the
Okay.
Queen Elizabeth Hospital in Blantyre, having gone from having the highest record of number of child rabies deaths from any single institution in the whole of sub-Saharan Africa, went to the lowest because of that program that we'd instigated. So that was a great example of how essentially a system can modify and change, evolve, and make a difference.
Tell me about the program. What did you do?
Well, these sort of things are kind of always structural. They're not necessarily theory. We work very closely with the government. We delivered a robust, scientifically backed vaccination strategy to cover at least 70% of the dogs in the area to stop the transmission of rabies. Rabies obviously spreads. 99% of all human cases are caused through dog bites, and the reservoir host of the virus is dog populations. So if you can vaccinate a sufficient number of dogs, so the statistical probability of a dog with rabies biting a dog that's already vaccinated is more likely than not, then you break the cycle of transmission. So we'll all know this from COVID, but the R naught of rabies, the rate of transmission, is roughly around 1.2. Obviously varies a little bit depending on population density. However, if you can vaccinate enough dogs so that the odds on that virus spreading, and the R naught is, as I said, the rate of transmission, so a rabid dog will spread it to at least one or two other animals before it dies. If you make sure that the odds on that is that it won't be able to spread it, by establishing sufficient herd immunity, you'll break the cycle of transmission, eliminate disease. And that's exactly what we did in that whole city. And we evidenced that as a proof of concept that was then picked up by other districts in Malawi, and then that has spread out. And in fact, this year, a decade on, we're going to cover, with the government driving it, but we're going to help them cover 22 of the 28 districts in the entire country, which is phenomenal.
Fantastic. You know, rabies is considered almost entirely preventable, and yet there are so many countries with large stray populations that continue to struggle with, both vaccination coverage and bite management. What separates countries that successfully contain the problem from those that remain, say, stuck in cycles of crisis?
Well, this is where India, I think, leads the world, because rabies is entirely preventable. There's absolutely no doubt about it, and yet it is endemic in over 150 countries. The reason why it's still so prevalent is because it's spread by dogs. They're the reservoir host of the virus. It's really all about vaccinating the dogs. And many government programs simply don't fund that. They just don't do it. No one's going to go out and vaccinate dogs. And then how do you make sure people have done 70%? But that's the whole thing about Mission Rabies. And that's what Mission Rabies India has done by the phenomenal Indian team leading and driving that. They vaccinated over 1 million dogs in India last year, recorded on the app, which is astonishing. They've made Goa the first rabies-controlled state in the whole of India, which is just, everybody said that was impossible. And the Goan government were fantastic, backing that program, seeing the benefits of it, supporting it fully, and they've now got the first rabies-controlled state in India as a result, which I think is incredible. And that's Indian leadership with Indian teams driving an Indian solution to an Indian problem. It's not an Indian problem, it's a global problem. And that is used as a showcase for countries all over the world. So in India, statistically, someone's bitten by a dog, I think, every 2 seconds. There's a paper on this. It's amazing. And, if we can break rabies, which can be done, then it will be a landmark. Many other countries now are using India as an example. So we're involved in 26 countries where we're doing rabies programs, and India pretty much comes into the conversation, nearly all of them, as an example. And we're going to vaccinate probably about 600,000 dogs in 2 weeks in Laos next year, for example, based on the same model used in India, which has delivered.
Luke, tell me about your most difficult experience in India.
Yeah, I mean, absolutely. A lot of places we go to, especially for the first time, can be quite resistant. In India, for example, we've sent catching teams in to areas. And in fact, I remember one incident where they got in trouble with a local gang who essentially said they were trying to make money out of vaccinating the dogs on their patch, and they wanted to extort them and get the money for doing it, essentially. And then they beat up some of the guys, and it was horrific. And I was down there by myself to meet with the local gang leader. Obviously, it's ridiculous, isn't it? I'm going to be 50 this year. I'm an Englishman. Who the heck am I to interfere in Indian street dogs? It's insane. But I went and I met with the guy, with the gang guy, and he rode up on his motorbike where we were going to meet and got off. And he looked a bit like, I kid you not, he's looking a bit like Vin Diesel. I mean, he's in this muscle vest and so that is insane situation. And I thought, my goodness me, I've completely misjudged this. I am going to get in trouble. I'm completely out of my depth. But I sat with him, and I obviously had my laptop with me, and I gave him the exact same presentation I'd given the chief minister 2 days before, and I went through it. And he was just looking at me. I think he was having a whiskey, actually, if I'm honest. And I had a chat with him. I looked at him and I said, well, look, the honest truth is I'm a dad. I mean, I've got into this. I've got 4 young kids. It was India that absolutely inspired me to get involved in the first place. One of the trips when I was in India, there was a rabies incident. And I remember watching these little girls sitting in the dirt playing stones and just being really worried for them, because I knew there were 3 other dogs who had been bitten by this rabid dog in the area. They could bite them. And I thought, it's so sad. If we vaccinate these dogs, it will protect them. Don't you want us to do that for your children? Do you not want your children to be safe? And if we don't vaccinate these dogs, this rabies virus can kill them. We've got to do this. And we need your help. You've got to be on team. Afterwards, and I was with this guy for 40 minutes. And afterwards, he stood up and he just gave me this big bear hug, got on his bike, roared off. Never a single bit of trouble in that whole area again. Vaccinated all the dogs, no problem at all. No more fights, nothing. It was awesome. I would say 99% of the time, once we go over and explain it and we talk about how we're stopping children dying from a totally preventable disease, everybody gets on board with it. And that's the wonderful thing about these projects. This sense of community, it's so inspiring. And every project we do now globally is an international team. And I would say nearly always half of that team are Indians showing the way. It's regularly a thing. I did a project last year where there were people from 30 different countries on that project coming together to vaccinate the dogs. It's a global problem, and there's strength in unity. And India can lead the way in showing how it can be done.
Here's what stays with me from today's conversation. 3 guests, 3 very different vantage points, and yet the same conclusion emerging again and again. This problem is solvable. We know the science. We know what works. We've seen it work in Goa, Dehradun, Nainital, Bhutan, Dhaka, even Malawi. Also, just an aside, despite the negative noise around the judgment, one clarification matters. The Supreme Court has not allowed indiscriminate killing of stray dogs. The written order still says euthanasia must follow the Prevention of Cruelty to Animals Act and the Animal Birth Control Rules. In other words, only certified veterinarians can take that call, and only in cases involving rabid, incurably ill, or demonstrably violent dogs after proper assessment. What has never worked, not in India, not anywhere else, is fear-driven policy, panic-led culling, mass removals, shelters without infrastructure, funding, or care. Because when vaccinated and sterilized dogs are removed, other unvaccinated dogs move in and the cycle simply begins again. The answer then is to manage the problem patiently, to build functioning sterilization and vaccination systems. Don't forget, the stray problem is also a civic problem. One of the solutions is to control waste better, to support communities. Also, adopt and register. Gauri told me if 3 people in every 100 adopted a stray dog, there would be no strays in the country. And above all, the solution is in demanding that governments do the slow, unglamorous, deeply necessary work they have avoided for decades. That's it for today. You are listening to this episode on The Morning Brief. It was produced by me, sound designed by Amrit Reggie. Keep listening to The Morning Brief and our other shows, including Corner Office Conversation, wherever you get your podcasts. Stay tuned.